Well, thank you all for joining us for another Cell Series webinar, Lifestyle Medicine Across the Cancer Continuum. Before we get started, a few housekeeping reminders. Please use the Q&A box to ask questions. We will hold all questions until the end, but I may be answering some of them as I'm able throughout the webinar as well. This session is being recorded and will be posted to the NCC YouTube channel if you'd like to watch or share a replay, and you'll receive a survey link at the end of the session via email to rate the session. I am just so happy today to introduce our presenter, Dr. Madeline Hardacre, currently serves the role of Oncology Wellness Physician for Renown Health's Pennington Cancer Institute. She has a longstanding interest in practicing medicine by combining the foundations of a healthy lifestyle with traditional medical therapies to address a patient's unique health concerns. She has applied this interest to specialize in wellness and cancer survivorship care. Prioritizing oncology wellness, she proactively assesses patients' needs and connects them to tailored resources to support optimal thriving throughout their cancer journey. Dr. Hardacre earned her medical doctor degree from Indiana University School of Medicine. She is currently board certified in multiple things, not a thing, in obstetrics and gynecology, lifestyle medicine, and obesity medicine. I am particularly proud of her one-star patient review online. It's my favorite story, in which it was claimed that she talks too much about exercise. Dr. Hardacre, we are very glad to have you here today. I am sharing your screen. Please take it away.
Okay, thank you, Lily, and thank you to the Nevada Cancer Coalition for inviting me to be part of this lunchtime series. And let's see, there should be a couple slides before that.
Oh, yes, there is. Thank you.
Yes, there we go. Okay, and as Lily said, I'm Dr. Madeline Hardacre. I'm at Renown Health. My office is actually located at the Conrad Breast Center in South Meadows. So we're going to talk about the use of lifestyle medicine in oncology care. And I'm really going to actually focus a little bit on more from a prevention risk reduction standpoint today. So few objectives. We are going to talk about what exactly lifestyle medicine is and what the 6 core pillars are that are used in lifestyle medicine. Then we'll spend most of the 40 minutes or 45 minutes we have talking about how we can use lifestyle medicine to really reduce our risk of cancer. Then we will talk about how these things can be applied then in cancer survivorship, which is how I spend most of my day. And then lastly, I'll give a little brief review of what we do at Renown Health in the Oncology Wellness Clinic and how we integrate this care into our oncology care. There we go. Okay, so first of all, 6 pillars of lifestyle medicine, and these have really been defined by the American College of Lifestyle Medicine. It's an organization I got involved with back in 2018, became board certified in 2019, and then really it drastically changed the trajectory of my career because I just embraced the use of these 6 pillars in my patient care. And so these are, first of all, it's important to recognize these are very evidence-based pillars. So we are talking about things that have significant scientific evidence behind them, and then using them to really help prevent or reduce the risk of chronic disease. So plant-predominant nutrition, and I'll talk about what exactly that means, physical activity, management of stress, good sleep, high-quality sleep, social connection. And so this is our social connections, our relationships, our support systems around us, which of course play a very important role in our health, and then avoiding risky substances. So, okay, go to the next slide. Thank you, Lily. And then the other thing, actually, I'll just mention from that slide, the last slide and this slide, is, this is not just about reducing risk of cancer. These lifestyle strategies, as I said, these are really designed to reduce the risk of chronic disease. So it is our cardiovascular disease risk, our metabolic health, improving our metabolic health, reducing our risk of diabetes, lots of data from the standpoint of our cognitive health and preventing cognitive decline as we age. So anyway, it's not just cancer, but we're going to focus on from an oncology standpoint today. So first of all, I'm going to talk about just how we use these 6 pillars from a risk reduction standpoint. Okay. So first of all, I love this because we have this American College of Lifestyle Medicine, who of course has, in their guidelines, the use of lifestyle medicine to reduce the risk of cancer. But it's not just through lifestyle medicine. All of our major organizations encourage this kind of care to prevent cancer and improve outcomes. So it's the American Cancer Society, World Cancer Research Fund, American Institute for Cancer Research, their guidelines, American Society for Clinical Oncology. So this is ASCO, the big organization of oncologists. It's in their guidelines. National Comprehensive Cancer Network is in the survivorship guidelines. And then, of course, like I said, for American College of Lifestyle Medicine. So these recommendations are increasingly being embedded into standard risk reduction, our high-risk clinics, things like that, but also in the cancer survivorship space for a number of different reasons there. So, and in this talk, I'm going to be doing a little combination of some of the scientific data, but then also some of kind of the practical implementation of these things. So, this is data that was published several years ago, but really looking at our lifestyle and modifiable risk factors. So it is estimated about 40% of all cancer cases and about a half of cancer deaths are attributable to what are called modifiable risk factors. So these are things that we have a little control over. If you look at this graph, it looks at the population attributable risk of these different things. But I don't know if you can read the fine print, but it has, cigarette smoking, excess body weight, alcohol consumption, red and processed meat, low intake of fruits and vegetables, all very much at the top of that list of modifiable things that we can do to reduce that risk. And I always, I like to point this out to patients because, when we discuss this, this is not meant to infer or suggest that cancer is anyone's fault, because we have to recognize that there is just an incredible complexity to the diagnosis. There's no single factor that's going to cause it. But if we can address some of these things that we do have the ability to change sometimes, then it is, it's an incredible opportunity for our, individual patients in our clinic setting, and then of course at a community level. Okay, doing the next slide. So this slide is a little redundant, so I won't spend long on it, but really over the next several slides, I'm going to just talk about what some of these big leading groups recommend. And then, so I'll first present their recommendations. Then I've chosen some of the data that's behind those recommendations. And then also, I've tried to put a slide as far as the mechanism of action and kind of why these things are important. So, it'll be American Cancer Society, AICR, National Comprehensive Cancer Network, ASCO, just looking at their guidelines. Well, first, I was just going to go over nutrition as far as how can we use nutrition to really decrease our risk, decrease our cancer risk. And I have to be honest, like if you go back 20 years ago and like somebody would talk about nutrition, and I did grow up with a very healthy diet because I grew up on a dairy farm, and we had a huge garden, and we raised our own meat, and so I grew up in that kind of environment, but I did not understand the importance of that on my health. And I can think back to a point in time where I kind of viewed like nutrition as like, oh, that's kind of woo woo, and there's not like real, is there real science behind it? But let me tell you, there is real science behind this now. So this is not some kind of like soft recommendations. We now know that these things are integral parts of preventing cancer and then in the survivorship space. So as far as what these recommendations are from a dietary standpoint, first of all, having a very plant-predominant diet. And what that means is really kind of thinking about our foods, looking for whole foods, which is the second point on here. So really selecting foods that have been minimally processed, trying to avoid all those things that are made with refined grains, processed sugar, all of these things that have like long ingredient lists. We want to try to really kind of shop, most of the time in the produce section, like buying just real whole food. And the way I explain this to my patients is when you look at your plate, when you sit down at your meal and you look at your plate, you want to be able to just simply look at the plate and identify what the ingredients are that you're eating. And then you want 2/3 of your plate to be whole plant foods. So fruits, vegetables, whole grains, beans, lentils, nuts, seeds, those kinds of things on your plate. So making like beautiful bowls or salads or soups or those kinds of things that are just very plant predominant and made with whole foods. The third point on here is limiting red and processed meat. And, I never tell my patients, okay, you can't have those things, but really try to keep those things minimal and infrequent, and focusing most meat consumption on very lean protein sources. So things like white meat, poultry, fish, and then, of course, our plant-based protein sources. We also want to limit sugar-sweetened beverages and really focus on hydrating with water or unsweetened things. Really trying to minimize fruit juices, which frequently have added sugars as well. If you start looking at food labels and looking at added sugar, then you will be surprised at what you will find in some of our beverages. And I always kind of point out like sparkling water is fine too. So kind of finding those better ways to hydrate that don't incorporate added sugars, and ideally not a lot of artificial sweeteners either. Limiting alcohol as well. So these are the recommendations that really are consistent across all of these guidelines, and these are the things that I just on a regular basis am addressing with patients. And the other thing I like to say as far as nutrition goes is I encourage my patients to kind of focus on like A-, B+ work with this, because we recognize that we want a dietary pattern that feels sustainable for the long term. We don't want this to be a diet. We want it to be a lifestyle, a way of life really for the rest of our life. And so recognizing we do have birthdays, we have anniversaries, we travel, we do things where sometimes our dietary patterns change a bit. And we don't want to beat ourselves up for that. Just do the best we can and look for that kind of A- B+ work with it. Okay, Lily, you can go to the next slide. Thank you. So this is just a little bit as far as some of the data. The Predimed trial was published it was about 10 years ago now, but it was just a nice randomized controlled trial looking at nutrition intervention in women that were at high risk for cardiovascular disease. But what they found when they put these women into 3 different groups, there was a Mediterranean diet with extra virgin olive oil, there was a Mediterranean diet with nuts, and then there was the low-fat control diet. In the women on the Mediterranean diet, it was this dietary pattern that I just described. It was an abundant amount of fruits and vegetables and whole grains and nuts and seeds and healthy fats, fish and poultry, and there was moderate wine apparently, and then a diet low in red meat and processed meat. And the finding when they looked at breast cancer risk, then there was a 62% lower risk with the Mediterranean diet, 62% and 58% in those two Mediterranean diet groups compared to the control group. So, this is just one of the studies historically where then now some of these recommendations have been based on. And so, I thought I'd just share a little bit of the data there. Okay, Lily. And I don't know if anybody in this group attended the Pennington Cancer Institute annual meeting that was several weeks ago up in Pine Village. But my friend Urvi Shaw, who is a medical oncologist at Memorial Sloan Kettering, who does a ton of nutrition research, she actually published this article. I actually sent her a funny message because I was like, like when I'm searching open evidence and my, a very close friend's name pops up with her research, but she does a lot of research on nutrition and then is a huge advocate for a very plant-predominant diet. But her publication here a couple of years ago in JAMA Oncology showed these key mechanisms for how a plant-predominant diet decreases cancer risk. This has to do with dietary fiber. We want an abundant amount of dietary fiber and from diverse fiber sources, meaning that's why we want an abundance of plants and we don't want just vegetables, but we want the fruits, the vegetables, the nuts, the seeds, the beans, all of those things. The flavonoids, which are in plant foods, play a role in decreasing inflammation. We know a very plant-predominant diet decreases IGF-1, which has been implicated in multiple cancers. We also know we have just improved metabolic health with this pattern of eating. So we have improved insulin sensitivity, improved and decreased insulin levels, which play an important role in a particular oncogenic signaling cascade. We reduce inflammation with this kind of diet. So patients frequently will say, I want an anti-inflammatory diet. Well, if you want an anti-inflammatory diet, this is definitely one strategy, a very good strategy for decreasing inflammation. And then it also, just in general, a very plant-predominant diet is not a very calorie-dense diet. So, okay, you can go to the next slide. Okay, then I was going to talk a little bit about exercise. So once again, this is recommended by all these amazing organizations that give us guidelines in oncology care. And so from a cancer prevention or a cancer risk reduction standpoint, there are a few things. First of all, they recommend essentially 30 to 60 minutes of moderate intensity activity most days of the week. You really want 150 to 300 minutes a week of moderate intensity exercise. And so if you, kind of break that down, that 150 minutes, which is the bare minimum that we should be getting, that's 30 minutes 5 times a week. And then moderate intensity is, I'll describe it to patients as where you're exercising at a point where you can still carry on a conversation, but you feel a little winded with it. And so you want to kind of get to yourself to that point. In addition to the 150 to 300 minutes a week, not as part of, but in addition to, we want to incorporate in strength training, working the major muscle groups of the body at least 2 days a week. We also, above and beyond that, I point out to patients, there's the time we spend kind of intentionally exercising, but then we also want to try to limit our sedentary behavior and just have those, I'll have patients, I had a patient one time, she was like wanting to count her trip to Costco as her exercise. And I'm like, well, no, going to Costco is not exercise, but going to Costco is limiting your sedentary behavior because you're up and moving around, walking the aisles. And so we want to do both and have that very active life, but then also have time where we are specifically working to achieve these fitness goals. Some of my patients have never done any of this. And then I think it's important if you are that person to then really think about, because the term exercise can bring up a lot of negative thoughts for people, and so I encourage people to really think about it is how can I intentionally move my body today in a way that I enjoy. And so setting aside 30 minutes to go for a walk, or 30 minutes to dance around the living room with your kids, or taking the dog for a walk, or going on a bike ride, and just simply start with things that seem fun, things that seem enjoyable, and just look for consistency with that first, and then slowly let that build. Okay, Lily. Like I said, I was going to incorporate in some of the research. So this was a large prospective study that was done looking at being physically active in leisure time. And this looked at 1.4 million adults. And there was a lower risk of 13 different cancers when for those people that had higher levels of leisure time physical activity. So that's, like I said, that's getting out and walking and riding a bike and walking the dog and, playing pickleball or whatever those things are that you enjoy doing. Here's another one that looked at, this was, a large group of patients looked at prospectively 88,000 patients followed for 33 years, but looking at adherence to those physical activity guidelines, which were the 150 to 300 minutes a week plus strength training. And the participants of the study that actually engaged in that level of physical activity in a consistent way over their lifetime had this significant decrease in gastrointestinal cancer incidence as well as cancer mortality. So once again, it's just additional data showing that consistent long-term adherence to being very physically active lowers our cancer risk. So like I said, I like to show kind of what are some of the mechanisms. Why does this happen? Why does exercise decrease our cancer risk? We're finding more and more reasons for this. Once again, inflammation is involved, and we can decrease our kind of chronic inflammatory state that many people are experiencing, like through regular physical activity. We have better anti-tumor immunity. Our immune system is just boosted with this kind of consistent physical activity. We have improved metabolic health, improved insulin sensitivity. So once again, these are things that we saw with the nutrition, and now the exercise is also contributing to these same actions. Like we're aligning our body and we're creating this environment in our body that is hostile to cancer, and that's what we want to do. We want to really kind of live that lifestyle that works to prevent it. So, improved metabolic regulation with improved insulin sensitivity, and once again, decreased IGF-1, inhibition of those oncogenic signaling pathways with mTOR, and then improved genomic stability. There's also some interesting science as far as this is not on the slide, but the myokines, so our skeletal muscle when we're exercising produce these compounds called myokines, which have been shown to have these anti-tumor properties. So next slide. Oh, there we go. Okay. Minimizing risky substances, kind of alcohol, tobacco are two of the most common ones. Once again, advised by all of these leading organizations. I'm going to talk more specifically about the alcohol today. So Lily, you can go to the next slide. So as far as alcohol and cancer risk, first of all, this is a little interesting because when they've looked at how well known this risk is, it's only about 35 to 40% of people in the US are aware of this risk. And I frequently find that in my office when I start talking about alcohol. I mean, I think patients know sometimes that if excessive alcohol consumption is not a good idea, but they do not understand the link with cancer. And it is now well established that there are 7 different types of cancer that are associated with increased alcohol intake. And it's also one of these things where it's it is dose dependent. So it's like as we consume more and more alcohol, then that risk is higher and higher. And we don't really know what that safe amount is. There are, a number of identified mechanisms for this. We know that when we ingest alcohol, it is metabolized to acetaldehyde in our liver. Acetaldehyde is a known carcinogen affecting DNA repair. And so there's that, the oxidative stress. We know there's also hormonal effects with high alcohol consumption. This is interesting because it seems to be more of an effect with binge consumption and with increased estrogen levels seen. So for those patients that have hormone sensitive cancers, of course, we really want to discourage this. And then once again, chronic inflammation, which is just kind of a repeated theme with all of these things. Many times people don't know like what a standard drink is. The data I showed on the previous slide where that increased risk was per 10 grams of alcohol. A standard drink is actually 14 grams of pure alcohol. So a 12-ounce beer is 1 drink, 1.5 ounces of liquor, once again, is 1 drink, or 5 ounces of wine. And so if you start paying attention frequently, the pour on the wine is higher than 5 ounces. If you get a beer, then frequently it's a pint. So you have to start paying attention and recognizing, okay, this is actually more than 1 standard drink many times. And I love the fact that there really is, I feel it on a day-to-day basis. There is this engagement in this non-alcoholic lifestyle. And we're seeing it more and more. And if you go, I had a dinner last night and I just asked our serving staff if they could make me a mocktail, and they came out with this like beautiful, berry and basil sparkling, beautiful drink. So now, if you look at menus, lots of times there's mocktails, there's non-alcoholic beers, and I put in my little AI-generated photo, I asked to put in the Hoppy Hour, which our local brewery in Tahoe, the Alibi, has this hops water and non-alcoholic beverage. So anyway, just have fun and experiment with that, because it kind of fills that need to have something special at the end of the day or out to dinner, but without the alcohol. Achieving a healthy weight also is on, all of these guidelines, because we know excess adiposity. So our fat cells are what are called adipose cells. Adipose tissue is our fat. So adiposity is kind of that excess fat. And we want to really work on kind of achieving and maintaining a healthy weight or a healthier weight. So Lily, if you go to the next slide, I'll give some of that data. So there are 12 different cancers, and actually on some lists, 13, they'll list 13 obesity-related cancers. So these are cancers where the International Agency for Research on Cancer has identified them as being related to this excess adiposity, colorectal cancers, endometrial, post-menopausal breast cancer, gallbladder, kidney, liver, esophageal, ovarian, pancreas, gastric, multiple myeloma, and thyroid cancers all have this link. And once again, this is something where there's you have to recognize lots of different factors that play a role in cancer risk, but this is just one of the things that can contribute. And in the little graph, we see that overall cancer risk is increased as our weight goes up, and obesity-related cancer risk is increased as our weight goes up. Mechanisms, once again, very similar to the things that we have been talking about with diet and exercise, but things like chronic inflammation. This is actually a publication that was just very recent on kind of the translational science behind obesity and cancer, but chronic inflammation, the health of our gut microbiome, which is associated with our diet and our the consumption of whole plant foods and dietary fiber. For a healthier gut microbiome, altered hormone production, because adipose tissue, it makes estrogen. And so when we have excess adipose tissue, then we're also increasing our estrogen production. Of course, immune issues as well. So lots of different mechanisms that are associated with this. So strategies to decrease the risk of obesity-related cancer. There are really 3 strategies out there, and weight reduction is a powerful tool in lowering this risk. And so lifestyle interventions, so healthy nutrition, physical activity, these are the foundations. And so no matter what you pursue with these strategies, this always needs to be part of it. Is really embracing those lifestyle strategies. And even, I always encourage patients, and I'll calculate this frequently for them, is like, what would be 5% decrease? Like not, so, sometimes, if somebody's looking at what would their healthy weight be, by definition, it might be significant weight loss that feels very overwhelming. But we can look at, okay, what's 5%? And if we can make a 5% difference, then already that's a win because we're decreasing that risk just with that. Then I think we're all familiar with the GLP-1 receptor agonists. These are medications like semaglutide or the dual receptor agonist like tirzepatide. We have some new oral options. So they are very, very well known medications and ways to achieve meaningful weight loss. There was a trial that was published last year, actually it was in 2024, in JAMA, looking at these medications. Now the observational study was done in people with diabetes, but there was a lower risk of 10 of the 13 obesity-related cancers. So, we know that these things can, make it potentially we definitely need more data in this space, but could potentially make a difference in decreasing risk. Bariatric surgery is kind of the most effective long-term weight loss intervention. And there's a 32% decreased risk of obesity-related cancers with that. So there are these 3 other pillars with lifestyle medicine that we have to think about: sleep, stress, social connection. These are all very, they're lifestyle strategies that we know impact our health, but we just don't have the data, the scientific evidence we need to say exactly how to use these to decrease our risk of cancer. So while they are an important part of our lifestyle from a cancer risk reduction standpoint, I don't have data to say like, okay, if you are really engaged in your community and you have great social connections, that's going to decrease your risk of cancer. Definitely is going to contribute to positive overall well-being. So, okay, Lily, we can go on. So, and I'm going to move a little more quickly through these slides because I want to give plenty of time for questions, but applying this to cancer survivorship, just recognizing, first of all, cancer survivors, anybody from the time of diagnosis through the balance of life. So we really apply these same lifestyle strategies across the cancer continuum throughout this experience. And I will give a little bit more background with Lily. We have this growing population of cancer survivors right now, for 2025, 18.6. We know this is going to go up to 22 million by 2035. A number of different factors as far as why that population is growing, but we have better treatments, we have better surveillance, earlier diagnosis, we have all of these different things contributing to that in actually a positive way, but yet our number is going to grow. You know what, this really sums it up. I have some the data following this, but like I said, for the sake of time, I'll kind of speed through that. But our National Comprehensive Cancer Network guidelines, we have specific survivorship guidelines, addressing a healthy lifestyle. These are the things that we just talked about. Healthy weight, being physically active. So these are all the things that you want to do after a cancer diagnosis going forward. A healthy dietary pattern is the things that we talked about. Really trying to minimize alcohol, not smoke. The sun safety is in here, the nutrition, good sleep, and then recognizing this really frequently takes a very multidisciplinary approach to bring in all the resources to help make these things happen after a diagnosis. Once again, in our guidelines, these things start after diagnosis and are during treatment. So these are guidelines from ASCO and NCCN saying that our patient, like exercise should be part of treatment. And so I frequently have these conversations, kind of giving patients some of the data and the background as far as why these things are so important, really kind of throughout the continuum. There we go. These are, this is one of the studies just showing that when patients were kind of addressing these lifestyle factors after a breast cancer diagnosis, there was a decreased risk of recurrence. That decreased risk of recurrence actually was increased if patients had this healthy lifestyle and were adherent to these guidelines before their diagnosis. So that, kind of gives a little more importance to those things that we just talked about from a risk reduction standpoint, is even if we get a cancer diagnosis, then our outcome from that diagnosis can be improved by having this healthy lifestyle before and then continuing it after diagnosis. Go to the next one. You know what? I'll skip over this. This was more just kind of data. Yep. And then the challenge trial. Let me say something about the challenge trial. It was, let's see, one more slide back. It was just very exciting news in a colon cancer patient population. After treatment, they had groups exercise, or then there was the control group leading their normal life. And there was this significant improvement, decreased risk of recurrence in those patients exercising over years. I think it went out to 7.9 years or somewhere close to that. So very, very exciting. The biggest challenge is getting the word out. And you know what, I'll just go to the text in green. 85, when ASCO surveyed members, 85% of oncologists recognize the importance of all of these things, but just simply struggled either from a knowledge standpoint or just access to resources. But they really kind of needed somebody else delivering that intervention. And this really is where my role comes into play. And Lily, you can go to the next slide. Just in oncology wellness, we're essentially addressing these needs from the time of diagnosis. Going forward, I also see patients referred from the high-risk clinic who are also looking to address these modifiable risk factors who are, have a high risk for cancer. You can go to the next slide and skip through that. It's just more of what I'm saying. And yes, there we go. I want to have time for questions, and so I will wrap that up and not explain the details of what I do on a day-to-day basis as far as that clinic structure. So, and this, first of all, I have to thank Lily. Lily and I are both in this picture. I actually know her outside of the oncology setting. That's actually how I met her, was out on the trails here in our community. And I did a little blurring of the sign on one of our dear friends on her running attire there for the sake of making this presentation appropriate for a broad audience. But I think we can all agree with what that sign really says. And I will open it up for questions.
I feel like it's appropriate to be explicit about what the sign says. The sign says "fuck cancer," so. But yes, thank you.
So I thought, okay.
Thank you so much, Madeline. Questions for Madeline? Anything? I mean, the evidence is so incredibly compelling, and you said the challenge was getting the word out. What can everybody on here do to help get the word out?
You know what? I mean, yeah, that is a great question. I think just the more, like, there is already momentum behind this. Like within my department, I feel it. I have been in my position, it'll be 2 years at the end of this summer. I have incredible support from my department as far as what I do and having these conversations with patients, but we just need we need more of it. If you're a patient, ask your provider for this type of information. If you're at a high risk for cancer, then once again, asking your provider or, kind of sometimes we just have to do our own research, but looking at like what are the lifestyle factors that we can really use in the way I describe lifestyle to my patients is, I'm like, we're going to talk about the things you do every day in your life. Like, what are all those things? And then how can we align the way you're living your life on a day-to-day basis with that risk? So I think it's just talking about it. And so I have to, give you guys incredible credit for, inviting me here. And I am just so open and excited to, even though I don't really like public speaking, but I love talking about this topic. So the risk versus benefit, I see the benefit of, really getting the word out.
I appreciate that focus on risk versus benefits, because I'm like, I don't really like giving up bacon, but you see the slides on risk versus benefit. So,
and say I do not eat bacon, but I haven't for a long time. But when I smell bacon, there is that moment, like bacon or like a burger on a charcoal grill. Those two smells definitely kind of pull at my pull in something in my body where I'm like a little drawn to it.
I did to go ahead and just take everybody off since we've got a smaller group that hung in here till the end. I went ahead and enabled you all to be able to ask questions live if you'd like. So anybody you didn't feel like putting it in the chat, but you wanted to join the conversation a little bit, we'll give it a minute.
I appreciate taking your lunch hour because I know it's like, I know how work days are.
And on a Friday, but that's, it's hard to cram it in and we got to get the information out there. But everybody looks like they're enjoyed Melissa, go ahead.
I just had a question, Dr. Hardacre. Which of the lifestyle pillars that you were talking about do you find patients most open to or most resistant to changing?
Interesting. That's a really interesting question. And actually, I lead a group discussion with patients with head and neck cancers. And yesterday was one of those group sessions. And we actually had this conversation. And because it's kind of, there are not great consistencies. When I have a conversation with patients, I frequently focus on different things based on how our conversation starts. And I do a lot of, I also have experience or did training in health coaching. So just kind of motivational interviewing skills and kind of teasing out what their priorities are and listening for, language where they have identified maybe an interest in change. So, sometimes it's like, they'll make comments about, thinking about becoming more active or the nutrition. But I would say the kind of most common, oh my gosh, it's kind of a toss up between exercise and nutrition, probably as the priorities. But, some people are interested in really kind of addressing both. But I think both of those things are very kind of ingrained in our history and our upbringing, and sometimes are very, very new and difficult concepts and difficult behaviors for patients to change. That's not a great answer because it really is, I see the spectrum.
No, it's a good answer. Thank you.
Great. Well, if there are, that was some great considerations in that. Hard to overcome our childhood sometimes.
Yeah, no, that, and that's something I will explore with patients sometimes because, exercise might have a very negative, bring up a lot of negative thoughts for people, or, the same with nutrition or like food scarcity, or, there's all the, how we were raised with what role food played. Was it something that was like a reward or what, there are human beings are just complex.
I saw Amanda, it looks like you came off of mute. Did you have a comment or a question? It might just be the computer today. That's all right too. I think that's a phenomenal place to leave it. It's complex, but the data is there and moving in the right. Amanda said she had the same question as Melissa, so fantastic. Yeah, the data's there, and whatever we can do to help get the word out, we will. And thank you so much for all your time. Thank you to everybody who listened in. And send us questions if you think of them later. Thank you so much.
Thank you. Thank you, Lily.
Thank you.